Good morning, everyone. My name is Dr. Maofal. I'm the resident program advisor based in Dakar in Senegal. And I'm going to do this presentation on behalf of Dr. Mamadou Ndiaye, who is the National NTD Program Manager. So he will be in charge to do this presentation in French tomorrow. So today we are going to present the daily data reporting and use during an MDA in Senegal to facilitate effective feedback and drive action. First of all, we want to acknowledge to the staff from the national level, the regional level, the district level, the health post level, and of course, the community drug distributor who were involved in this activity. This activity was possible through because of USAID funding through the Envision project. We are going to give a picture of the disease in Senegal. So you can see in those maps that we have 5 endemic diseases. You have LF present in 50 districts. In the first map, you can see it in blue. You have onchocerciasis present in the southeast of Senegal in the region of Tambacounda and Kédougou. You have the schistosomiasis endemic in 57 districts. Joe Elmenchaz endemic in all the country in the 76 districts, and trachoma is endemic in 19 districts. So this was just to give you a picture of the diseases profile in Senegal. In this graphic, you can see 2 colors. You have the red color and the blue color. The red color represents the districts that did not reach its targets. It means that did not reach the 65% that is required. And the blue color represents the number of districts that has reached its targets. So you can see that between 2013 and 2015, there is more red color than blue color. It means that the result was really not good. So just for you to have an example, in 2015, 78% of the district did not reach their targets. That means in terms of number of districts, that 39 districts did not reach their targets. So among all those 50 districts, you have 10 districts that has a coverage between 60% and 64%. 11 districts that has a coverage between 50% and 59%. And 18 districts in red has coverage under 50%. So you can see really that there was a problem to achieve the epidemiological coverage in Senegal between 2013 and 2015. What does it mean? It means that we need to do additional MDA round of treatment to really reach the elimination. So because of this problem, because we had all these challenges and difficulty, an internal committee, a technical committee, has decided to work together and to propose a package and to see how really we can improve the coverage. So you can see now the different activity that was proposed to improve the performance. So we've put a greater emphasis on detailed and participatory micro and central level planning, more intensive social mobilization by having a good message by the shelter, by having radio spot, TV spots. We have also increased the ratio of distributor to households. It means that when the budget was, when the budget permits, we were increasing the number of drug distributor. Adding more day of distribution, it means that when you don't reach the goal on day 5, we can maybe add 1 or 2 days to be sure that we are reaching those goals. One of the specificity of our project in Senegal is that we have regional focal points embedded, located, working closely with the regional agents, participating in all the activity related to the MDA. When it's possible, flexible, we increase the budget for implementation. We have organized a bunch of training from the central level to the community level by We have also elaborated some manuals and some tools to be sure that the agent understand well what is asked. One of the activity that was really important was really the involvement of the senior official, involvement of the Ministry of Health during the MDA launch, but also during the campaign. When there was some challenges, they were present and we could really discuss with them to be sure that they can provide a solution. So there were already some tools, some many tools in the field. So the team, as I say, has worked on those tools to have better quality of data. Like if you take a tally sheet today, you will see that you have the results or the information related to the drugs. You have the information related to the name of the distributor, to the name of the village. So we have improved those management tools. But one of the particularity, one of the activity that really has improved all what we are seeing is really to strengthening real-time daily data reporting and action. So really, we were following closely the data on a daily basis. So these are the package that was proposed to see how we can improve the coverage during the campaign. So what is the goal of the real-time daily reporting and action? So it's really to take corrective action during the MDA to ensure sufficient coverage is met by getting a measure during MDA on whether coverage targets are being reached and an understanding of issues that needs immediate resolution. During the MDA, when you implement the activity, when at the end, during the debriefing, you see that target is not achieved, you know exactly where you have to go, you know exactly what you need to do. So this is the goal and how we can do that. So before moving forward, I think it's important also to discuss about the process, how things is functioning in Senegal, how the flow is functioning in Senegal. So at the bottom, it means at the village, you have the drug distributor who during the campaign give drugs to the sites, to the village. So usually you have a team of 2 persons, one who give the drugs and the other one who fill the tally sheet and do the sensitization. So at the end, they complete the tally sheet, and then they complete the tally sheet and they give it all to the health nurse, the health agent, or to the community supervisor who will drop it to the health level. At the health post level, so at the before that, they send those compiled data to the health post, or by walking, or they take a bicycle or a motor to get to the health post. So at the health post level, so the nurse and the health agent, they compile all the data, they do an analysis, and they calculate also the results. After that, at the end of the journey, they have a report that they will or send it to the districts, or if they have time, they can go to the district. But most of the time, they take their phone and they call to the data manager based at the district level. So they call it and they give him the results. So at the district level, the data manager compile all the data that he receives from the health post, and he discusses with his other colleagues on how the coverage is the coverage is good, is the coverage is not good, and then he send the report at the region level. At the region level also, it is the same mechanism. So the team compile all the data provided by the districts, they do an analysis, and then they send it to the central level. So this is how it is functioning on every day from the village to the central level. And at the same time, you have feedback. Feedback is provided on also a daily basis from the central level to the regional level, and then from the region to the district to the health post, and then the health post to the village. So the data are analyzed and sent on a daily basis from the village to the central, and debriefing and feedbacks are given on a daily basis. what information is transmitted. So here in this graph, you can see how a bit how it looks like. So you have information related to the person treated, you have information related to the drug administered, you have information related to the village treated. So you can see here in the first column you have G1, it means day one. So in day one you have the number of persons treated per male, per female, you have the total then, and then you have also the number of drug administered, and you have also the number of villages. So the sheet, this Excel sheet gives you all this kind of information and the age and the sex breakdown. So just for you, you can see day one, you have the age here, you have the number of persons treated, so 35 and 67. 35 means number of persons treated between 5 years to 14 years. 67, it's more than 15 years. So you have those information per sex, and you have the total also 209. You have also the drug distributed. So this is the information we have on a daily basis. So what information is analyzed? When you have the number of persons treated, when you have the number of villages, that sheet can generate automatically the programmatic coverage, the geographic coverage, the epidemiological coverage, and we can see also where is the problem, which district is not reaching its targets, or which health post is not achieving sufficient coverage. So these are the kind of information that is analyzed on a daily basis. So let's take an example. This is an output from a daily basis. So you can see here in the sheet, you can see in the first column, you can see the health post name. In the second column, you have the number of persons treated. So when you have this, it is automatically generated. So you can see that you have information. In the third column, you have information regarding the programmatic coverage. In the fourth column, you have information regarding the epidemiological coverage. And the color you have means where you stand. An example, if you have a red color, it means that the coverage is under 50%. It means it's not good. If it is between 50% and 65%, it is yellow. So the color gives you an overview of where it is functioning, where it is not functioning. And you know also exactly where you need specific action, So when you have a graphic like this, all yellow and red color means that it's not good, and you need really to have specific action on those health posts. You have also the opportunity to see the number of health posts that is under 50%. So you can have really a summary of the performance. So let's take an example in Bignona. It is in the south of Senegal, in the region of Ziguinchor, where we have compared results on day 3 and results on day 5 for the same districts. So here you can see that on day 3, we had an epidemiologic coverage of 30.91%. On day 3, it means that it was really, really not good. And you can see that most of the color is between red and yellow. So on day 5, you can see that most of the color became green. You have also blue color. You still have some remaining red color and yellow color, but at the end we have achieved our goal. We have on day 5 73.50% of coverage. It means that we have achieved those results. So that package that we have presented soon has permitted really to achieve this result. So you can see here we do debriefing. We do debriefing at the regional level, also at the district level. So we talk about the problems, we talk about the number of drug distributors, we talk about the days of the supervision. So these are things that we talk about. We can see exactly where we need action. So we need action where it is red, we need action where it is yellow. So we can also strengthen sensitization. We can increase the number of drug distributors when it's necessary, change the distribution strategy. So sometimes you can see that the drug distributors are just sitting somewhere, so they are just using a fixed point distribution. But as you know, for LF, the best strategy is to have a combined distribution. A combined strategy, it means to combine the fixed point and also the door-to-door points. And when all this is not possible, we just call the senior staff at the Ministry of Health for them to sensitize the regional and the district level. So we are going to take example of 4 health posts in the south of the country. So you have Centre de Santé in blue, you have Croix-Rouge in red, you have Aguillaï in green, you have Dinguiraye in violet. So you can see that they don't have the same situation, they don't have the same specificity. So let's take the example of Dinguiraye in violet. You can see that that health post has reached its targets on day 2. So no specific action was needed for that. We were just observing, and during the debriefing, we saw that really the coverage was going well. But if you take the example of Aguillaï in red, in green color, and also the example of Centre de Santé in blue color, so we had all the problem there, but we had specific package for that. We have increased the number of drug distributor. We have also strengthened the supervision on that. And we have even called the Ministry of Health at the higher level to be sure that they're going to sensitize the authority of those regions to be sure that they're going to reach the activity. So it was very difficult. You start stressing when in day 4 or day 5, the coverage is not really increasing. If you take the red color, it was really a close supervision. So we were in the field to see really if there will be not problem to achieve that goal. So you will see that Croix-Rouge on red color has achieved its goal on day 3. So everything sometimes is not so that beautiful. Sometimes you have some challenges. So one of those challenges is the distance between some villages, some health posts, and also some villages to health posts, some health posts to districts. So when it's very distant, you cannot really send, you cannot give the data on a daily basis. Sometimes you have limited internet access, so you cannot send on a daily basis the data through to the districts or to the region. Because it is a daily effort, it means that it's require really a daily work, a daily effort. So it's not really something easy to do briefing, to go to the field, to come back, to do debriefing, to analyze, and then to send the results. So it requires really a high level of effort. Sometimes also the budget is not flexible. So this is something also that can be challenging. And also we need to have capacity to act on data. So if you remember, one of my first graph was showing 2 colors, the red color and the blue color. So it was between 2013 and 2015. So you can see in this graph that when we've started putting in place the new packages, we are just in blue. So it means that it has permitted really to improve the performance. So 100% of the district that were treated has achieved their goal. So you can see that since 2016 and 2017, all is blue. So what are the conclusions? So daily data reporting in Senegal enables the national program to learn what is working and what is not working, to adapt activities to take corrective action during the MDA, and to accelerate towards elimination through maximizing resources. Thank you very much for your attention.